I hope you are all doing well. We meet once again. Today we are come to talk about how to handle instruments for things like wound dressing, any other thing that you need an instrument for. Since the whole thing is going to be a sterile procedure, you make sure you put on your mask. And you perform hand hygiene. So let me state that when you are working with instruments, you don't have to wear surgical gloves. That is for procedures like wound dressing. If you want to use a sterile or surgical glove, then you use only that to dress the wound. But when you are using instruments, you use your bare hand to use the instrument. For such purpose, you touch only the handle of the instrument. You don't touch the edge that should come into contact with the patient's skin. You touch only the handle. And you see, when you are arranging the instrument, all the handles should be on one side, so that you don't risk contaminating the parts that will come into contact with the patient. So you see, when you pick one like this is dressing or artery forceps, curved and straight. So you see it has locks. This is the lock. So when you push it this way, it locks it. So it is up to you to open it by pushing one finger out and one finger in. A part of the handle should move out and the part should come in. So you see, you do it like this. This one pulls, this one pushes. It's so simple. It shouldn't be difficult. This is the technique that students find difficult, and I don't think it should be. So you just do it this way. And then, so you use your dominant hand to hold the artery forceps. And then you use the non-dominant hand to hold the dissecting forceps in situations of wound dressing. So let's take it that. The dominant hand is the hand that will usually go to the patient's wound or the site, and this one only comes to the sterile form. So we expect we consider this as clean and this as sterile. The first time of picking the swabs, you can use either because they are both sterile. But after cleaning the wound for the first time, you don't bring this to where we pick the swab, and you don't bring it to the solution. So if I'm picking it like this with the dissecting forceps, the dissecting forceps doesn't lock. So you keep it closed with your own fingers. You release your fingers, it gets released. When you close your fingers, it closes. You don't hold the middle, you don't hold the tip, you only hold this side. So when you pick like this, and you dip it in the solution. Let's take a normal saline. You ensure that it is soaked. After dipping, with the help of the artery forceps, you hold it. Then you squeeze by turning the gauze around the forceps. I hope you saw what I did. You hold one part of the cotton, wet it, hold the other part with the forceps, the artery or the dissecting forceps, the artery or the dressing forceps. Then you squeeze. In squeezing, you the gauze around the forceps like this. And because it is like this and the forceps is already closed, you go and dress the wound or clean whatever you are going to do. Then you discard. When you refuse, when you fail to wind it around the forceps, you see that part of the forceps will be exposed. It means you are going to hurt the patient, because you are going to dress the wound and this part will be touching the wound, the metal. We don't want that to happen. So after cleaning, you then come and pick the next one. When you pick the next one and you wet it, you try as much as possible to prevent further contamination, but sometimes we do our best, but things still can get mixed up, because now this has gone into the wound, you still have to come and use it to squeeze. So the appropriate thing is that you don't squeeze it back into the solutions, because this one is no more sterile after going to the wound. So you squeeze it into another kidney dish like that. For this reason, you don't have to wet the gauze or the cotton too much, else you end up finishing all the solution without the wound being dressed. So let's do another one. With this, you open the dissecting, close your fingers and use it to pick. Then dip it in the solution, squeeze it, at the same time using it, passing it around the dressing forces like this. You are squeezing and turning like this. So when you are done, it's like this. They go and clean the wound and discard it. So that's all. You ensure that all contaminated items go into one part, and the ones that are not yet contaminated, we will still wash and sterilize, but then they shouldn't mix them. Thank you.